come on in.
Hi, I'm Katie.
Hi, Katie.
I'll be your nurse practitioner today.
Nice to meet you.
Are you Mrs. Schwinsky?
Yes.
Okay. You're here for your physical?
Yep.
Head to toe, H&P?
Yep.
All right. We'll just get started then. And you said your name was Mrs. Schwinsky. Do you go by any other name?
No.
No?
You can call me Ann.
Ann, okay. And Ann, how old are you?
45.
45. All right. And no, any major issues that you have today?
No.
No. Are you comfortable?
Yes.
Okay. My hands are washed. You have a beautiful gown on.
Thank you.
And the door is shut for privacy. Okay, so no major complaints. We'll just dive into your past medical history. Any recent or past surgeries or hospitalizations?
No surgeries, just hospitalized with each of my deliveries and for hyperemesis with dehydration for 2 of them. I was in and out, kind of just getting rehydrated and sent home.
Okay, okay. No complications since then?
No.
Okay, and no other surgeries,
No.
blood transfusions,
No.
any, okay. Immunizations, are they up to date?
All up to date. Just got my flu shot a couple weeks ago.
Okay, great. Any exposure, have you ever been diagnosed with MMR or measles, mumps, rubella?
No, I've been vaccinated against all the childhood diseases. I did have chicken pox when I was very young, probably about 18 months.
Okay, all right. No tuberculosis,
No.
hepatitis?
No.
Okay. Any recent travels?
No, not in the last year.
Okay. Moving along, any major medical diagnoses that you have been given or told that you have heart failure, blood pressure issues?
No, none at all.
Okay. Any depression or anxiety?
Just not currently, no.
Okay. Okay.
Oh, but in the past,
Yes.
just some postpartum depression after
Okay.
a couple of my pregnancies, but it was very short.
Okay, and is now resolved?
Yes.
Okay. No diabetes?
No.
Nope. Okay. Any medications that you're on?
Just occasional ibuprofen use.
Okay. Just for
800 milligrams I usually take for headache or body aches, anything like that.
okay. Usually don't need any more than that. Any allergies to food?
No, none that I'm aware of. No drug or food allergies that I'm aware of.
No
I have a little bit of
seasonal?
seasonal,
Okay.
especially in the spring.
But you don't take any medication?
Sometimes I'll try some Claritin or something, but it usually doesn't make much of a difference.
Okay. Okay. And do you know your dose of Claritin?
10 milligrams
10 milligrams.
once a day.
Okay, great. All right, moving on. Social history. What do you do for a living, Ann?
I'm a registered nurse.
Okay. How long have you been doing that?
Over 20 years.
Okay. Wow. And your home situation. What's your housing like?
We own our own home.
Okay. And when you say we, who is that?
I live with my husband and my 3 children.
Okay. Very nice. Full house.
Yep.
How long have you and your husband been married?
23 years.
Okay.
22 years.
22 years? Okay. And are you and your husband, do you remain sexually active?
Yes.
Yes. Okay. Do you do any safety steps or anything to?
You mean like contraception?
Yes.
We use condoms.
Okay. Do you feel like you're done having children, or?
Yes.
Yes. Okay. All right. And do you feel safe in your home and with your husband and in the community?
Yes.
That's a lot of questions. Yes, you do.
Yes.
Okay. And any tobacco use?
No, never smoked.
Okay. Have you used any tobacco product like chewing?
No.
Nope. Any alcohol?
Rarely.
Rarely.
I don't really like to drink.
Okay. And rarely, is that like once a day, once a month?
Maybe once a month.
Okay.
Once every 2 months.
Okay. Any recreational drug use like marijuana or?
No, not currently.
Okay. And could you elaborate?
I just tried some marijuana in college, so just years ago.
Okay. Did it ever impact your life?
No.
Okay. All right. Thank you for sharing that. And sounds like you have big, busy household can be stressful. Do you do anything to help balance the stress, life-work balance? Do you anything for enjoyment in life?
I like to read, and I run. I've trained and ran several marathons, but I'm not training for anything right now.
Okay, good for you.
And we do a Bible study with a group of couples every 2
Okay.
weeks.
All right, staying busy. Good. And family history, your husband and 3 children, are they still alive and
Yep.
in
All
good
my
health?
3 children are all healthy, full-term pregnancies, except for the last one. He was premature, but he's very healthy.
Okay,
My husband is alive and well and healthy. No medical problems for him.
great. How about going back a generation before, your parents? Are they?
My mother is still living.
Okay.
She's alive and well.
Okay.
No chronic medical history conditions at all. My dad's been dead for, 20 years.
Okay,
And he died of heart failure,
okay,
heart disease.
all right. Do heart conditions run in the family, and your grandparents or uncles?
I think maybe my paternal grandfather died of hypertension, heart disease, but I'm not sure.
Okay. Are any of your other grandparents still alive?
Nope.
Did they pass away from any major medical?
Both my grandmothers pretty much just old age, broke a hip, one of them, and my grandfather had Parkinson's disease.
Okay. Any other family medical history?
Nope, I have one brother and 2 sisters, and they're all, no medical problems.
Okay. All right. No history of, or is there any history of depression or anxiety that runs within your family?
Yeah, just some mild depression, kind of my siblings all, and maybe my mom a little bit, my grandma when she was still around, yeah.
Okay, okay. All right. And you mentioned that you had a flu shot earlier, so you're keeping your health maintained. When was your last physical exam?
Probably about 9 months ago.
Okay. And have you had a pap smear with that exam?
No, I have a pap smear usually every 3 years, because mine have all been normal.
Okay, good. And have you had a mammogram?
Yes, I have a
Yes.
mammogram yearly since I was 40.
Okay. And have you had a colonoscopy?
No, not yet.
No, okay. And looking, like with your cholesterol or anything, have you had your cholesterol checked?
Yeah, last time it was checked was probably about 3 years ago. It was 112.
Okay.
And my LDH and LDL were good ratio, but I don't remember the numbers particularly.
And I see here that your current weight is normal as well as your blood pressure and your BMI. Have you had any concerns or anything with any of recent or past vital signs of blood pressure?
It's all been good. Never
Okay.
had any hypertension.
Okay, good. Well, everything looks good here too. And moving to the review of systems, and if, okay, any recent like fevers, chills, night sweats?
No.
Increase in fatigue?
No.
No change in sleep patterns? Nope. Okay. What appetite? Has your appetite changed?
No, normal.
Okay.
Same as always.
Good. And your mood?
Good.
Good? Pretty easy?
Yep.
Okay. How about your skin? Any rashes, bumps, lesions, moles of concern?
I've had a little bit of eczema on my legs that has been worse lately, but not bad.
Okay. Okay, is there anything that makes it go away or better?
I just try to make sure it's well moisturized after I take a shower.
Mhm.
Use some Cetaphil lotion on it.
Okay. All right. Any change in hair distribution or anything?
No.
Hair pattern growth? Are you losing any hair?
No.
Okay. Any pain or tenderness or swelling in your neck?
No.
Any hoarseness in the way you talk?
No.
No difficulty swallowing? Okay. Any headaches recently?
Just a rare headache every now and then.
Mhm.
Usually one before I have my period, but
Okay.
that's pretty normal for
Okay.
me.
Alright, and that's what you would take your Tylenol for, and that usually
Usually
helps.
ibuprofen works better
Oh,
than
sorry,
Tylenol.
yes,
so.
ibuprofen, yep. Okay, and no recent bonks to the head or trauma or anything?
No.
Okay. Any vision changes? No.
Well, I'm thinking I'm probably gonna need reading glasses eventually here, just a little bit of difficulty with small print, but
Okay, sweet, okay. Small print, make sure the room is nicely lit when you're reading. No double vision or
No.
blurry or
Nope.
anything like that? Does light, hurt your eyes ever?
Nope.
Okay, no just generalized pain, no eye pain, okay? How about nose, any increase in drainage, any change in drainage, clear, green, bloody?
Nope.
Okay, and smelling is
seems
normal?
to be normal, yeah.
Hasn't changed? Any problems with obstruction, like feel like there's anything blocking your breathing? Nope. How about your mouth, any soreness, pain, increase or decrease in saliva?
No. See the
No
dentist
dryness.
every 6 months.
Okay,
I need a crown, but he said I could wait a while.
okay, not urgent. Alright, and your heart, I know that sounds like heart conditions kind of run in the family. Any feelings, of like your heart skipping a beat or
No.
beating too fast or anything? Any
No.
changes in circulation where you're really cold or
No, all normal.
blue,
No.
mouth, hands? No? Okay. And lungs, any problem breathing or difficulty breathing, shortness of breath? No? Alright, and have you had any coughs or anything recently?
Nope.
No? Okay. Are you voiding and urinating normally?
Mm-hmm.
Do you, so no increase in voiding?
No.
Okay, any pain when you void?
No.
You go to the bathroom? No. Any blood in your urine? Nope. Okay.
Sometimes I pee if I cough or sneeze,
Oh,
just a little bit.
that'll happen after having kids, I hear. Would you say your urine is well concentrated or like a nice yellow,
Yes.
clear pale? Okay. And as far as bowel movements go, any constipation,
No.
diarrhea,
Nope.
staying
Had a
regular?
little problems with constipation when I was pregnant, but otherwise, no. Normally, just normal.
Like once or twice a day?
Usually once a day.
Okay. Okay, any thyroid problems or problems regulating your temperature of your body?
Nope.
No. Any, and you said no changes in hair growth? Nope. Okay. And any pain or stiffness in your muscles or like seem sore, like your
No.
joints
Nope.
achy or anything?
Not at all.
No neck, back pain?
No.
Okay. Any growths on your feet that are like white or anything?
No.
Nope. Okay. And have you had, you said you do get headaches every once in a while, but any increase in like dizziness or
No.
none of that? Any feelings of feeling off? Like just not yourself? No. Coordination seems normal?
Yep.
Okay. You said your mood was good. Any change in your behaviors, or do you feel anxious or more depressed or less or anything? No? Okay. Getting a little personal. Any changes within your breasts?
No.
Any pain, tenderness,
Nothing that I noticed. No.
Okay. No discharge?
No.
Okay. Did you perform self-breast exams?
Yes.
You said once a month. Okay, which is great. And are you still getting your menstrual periods? Yes. And any change in the pattern there?
Nope, very regular, just maybe a little bit shorter in duration over
Okay.
the last year or two.
Okay. And the flow remains the same as well? Okay. Any pain?
No, just
Your
normal
normal.
cramping kind of stuff, but nothing that disturbs my way of life.
Okay. Well, thank you for sharing all of that. And just one last thing with concentration. Any issues with concentration?
No.
Okay. Sorry, that was a lot to ask. Now I'm just going to move on for the assessment. So this is the hands-on part.
Okay.
And I'm just going to, I'll instruct you with what I'm going to do. And I'm just looking at you right now for your skin. And you said that you have some eczema on your
No,
legs.
mostly on my legs right now,
Mhm.
yeah, I don't think I have anything on my upper extremities at all.
No.
Maybe right under my wedding ring it gets a little funky, but
Oh, sure, stuff gets trapped underneath
Yeah.
there. Okay, well, I don't see any abnormal bumps, bruises, rashes, and I would come fully behind you. Any birthmarks of concern?
no.
Nope. Okay, and now I'm just going to kind of feel your head here. Any bumps, lumps, or tenderness? I'm feeling for lumps, bumps, tenderness.
Nope, doesn't hurt at all.
Okay, good distribution of hair. I'm going to feel it for your lymph nodes. Back here are your occipital lymph nodes. Making my way to the front to your post-auricular, anterior auricular. Now to your TMJ. Good. And bite down. Okay, that's good and intact. And submandibular, segmental, and now your tonsils. Let me know if there's any pain or tenderness as I move down your anterior cervical nodes, posterior, and supraclavicular, and infraclavicular. It's nice that you don't have a scarf on, you know. It's a nice gown that you have on so I can feel everything. Okay, good. And now just staying up here, I'm going to have my hand here. If you could resist my hand. Good. And the other way. All right, and try just turning your head. Good. Okay, and resist against my hand. Great. All right, now have your shoulder shrug. Wonderful. Can you move your head to the side and also back and forward and twist? Good. Can you smile for me? And frown? Puff out your cheeks? Stick out your tongue? Raise your eyebrows? Okay. And now close your eyes and don't let me open them, okay? Good. All right. I'm going to look into your eyes a little bit more, and it looks like your conjunctiva is good. Could you lift your eyes up? Eyelids? Good. And down? Okay. Looks good. And I'm just going to have my pen light here, and I'm going to, if you could look at my nose, I'm just going to shine a light. Good. Now I'm looking in your other eye. I'm going to constrict.
What's that called, accommodation? Is that what that is?
That's consensual pupil dilation. Okay, good. Now I'm going to have you look at my finger and then look at this object on the wall, okay? So look at my finger, and now the object on the wall. Finger, object on the wall. Back to my finger. Good. All right. Follow my pen light with your eyes, not your head. Good. Great. All right. And now if you could cover one of your eyes and then tell me when you see my hand.
No,
Okay?
no, no,
Okay?
no, no,
Good.
no.
Good. And I'm trying to be equally between you and me. And then if you could keep, and I would do that to the other eye as well. Now keep that eye covered and look at my nose. And then drop your hand. Okay, and do it to the other eye. And drop your hand. Great. Okay. Now I'm just going to look at your ears. Oh, and the corneal, to make sure that I see the light reflection in both of your eyes in the same spot. Good.
Are you gonna look like in the back of my eyes?
Oh, yeah.
Thanks.
spaced. Alright, so your tendon's working. Okay, now I'm just going to look into the back of your eyes for the blood vessels and making sure I can see everything okay.
Where do you want me to look?
If you can just look past my
Okay.
shoulder, okay? And it's a good thing the light's nicely dimmed. Come in. Okay, looks good. Sorry, I had to get really close there. And I would do the other eye. I was able to see your optic disc and good vasculature. And since I'm using this fancy equipment, I'm going to look into your ears. I don't see any redness, bumps, lumps, drainage. Looks patent and good on the inside and on the external canal. Any pain when I do this?
No.
Or this?
No.
Okay, I'm just going to insert my otoscope. You feel a little pressure. Okay. And I'm looking for your tympanic membrane, which is nice and pearly gray, and I see the bony landmarks and the light reflects, which is good. And I would do that to the other ear. Excuse me. Now, if you could put your hands out and then repeat the motions that I'm going to do. Good. And then try to put your hands up, put them down. Okay, now resist my hands out and in. Good. Can you put your hands up together? Good. And then behind you, from your lower back. Great. And there's some hearing tests that I'm going to do. So I'm going to strike my tuning fork and place it in the middle of your head. Can you hear it in both or just one ear?
Both.
Okay, and it's still going. I'm going to place it here. Can you hear that?
Mm-hmm.
Tell me when you can't.
Stop.
Okay, can you hear it now?
Mm-hmm.
Great. And I would test that on both. And then I'm going to take this soft tissue, and you're going to close your eyes and tell me if you can feel a soft or a sharp object, okay?
Soft. Soft. Sharp.
Good. I would do that to both of them. And since I have this handy, I'm going to just test my nerves here. Can you feel that
Mm-hmm.
buzzing? Good. And I might as well, since I got your arms, I'll go here. I'm just going to test your reflex. You just relax your arm. This is your bicep. Good. And then your tricep. Good. And brachioradialis. Good. Okay. Moving on, and I would do that to the other arm as well. And now I'm just going to move to the back and look at your work of breathing, and it looks symmetrical with that nice deep breath. No abnormalities, nice even chest rise. And then could you take another good deep breath as I test excursion? Good. And now as I move my hand down your back, say toy boat.
Toy boat. Toy boat.
Good.
Toy boat.
Alright. So I'm going to percuss. Paying attention to different sounds. Okay, and tell me if there's any pain here.
Nope.
Any pain there?
Nope.
Nope. Okay. I'm just going to listen to you. If you take a deep breath with each time I change spots. Good. And I would do that 6 times in different aspects of her lung. to the front. And do very similar by testing the front of your lungs. I'm going to percuss. Good. Okay. And then I'm looking also to see equal chest rate, which I kind of saw earlier. I'm going to listen again in the front. My stethoscope is cleaned off too, by the way. The chest. A good breath, I should say. Good, and I would do that in 6 different spots, making sure on the right side I'm in the mid-axillary area to get the middle lobe. And I go down a little lower and lower. Okay, and I'm looking for work of breathing. So that looks good. And also, before I have you lay down, I'm going to listen to your heart. Okay? And at that, with your heart also, I'm going to feel for your pulses up here and the brachial pulses. Good. Okay. I'm going to listen first with the diaphragm in the pulmonic, second intercostal on your right mid-sternum area.
You mean the aortic?
What's that?
You mean the aortic?
Yes, what did I say? Pulmonic?
Okay.
Yes. Aortic on the right. Right across the pulmonic. And then one intercostal down is Erb's point. One more down is your tricuspid valve. This is where I can hear S1 the best, so your first heart sound. And now moving to the 5th intercostal space, mid-clavicular. And listening for your mitral. Okay, this is where I can more readily hear, again, S1, and I can also feel more readily the point of maximum impulse. So I'm just going to take my hand and just kind of feel here. Sometimes it's easier if I have you lay down too. And I would also listen again with the bell to make sure that I don't miss anything. So I'll have you lay down and I'm just going to feel your heart again. Right here. Making sure I don't feel any thrills or heaves. At the apex and the base of your heart. Feels good. And I'm going to listen to your carotid artery. Now that I've found, I'm going to compare it with your PMI, with your heart right here. Good. No abnormal sounds or bruits. I'm going to listen to your arteries further down, to your aorta, or your aortic artery. Now, ambitious sounds. Renal. And then iliac. And femoral. Okay. I'm going to further inspect your stomach. Nice and flat. And now I'm going to listen to your stomach too before I start kind of touching and feeling around. Listen to each quadrant. Okay. I'm going to try to just percuss and then feel for a couple organs. Tell me if there's any pain or tenderness. 2. The different sounds. So here I feel would be almost where your liver would be. So I'm going to ask you to take a deep breath in. And try to feel. Okay. And you can breathe now. Is there any pain or anything there? No. Do the same for your spleen. On this side, I'm going to go mid-axillary line, deep breath in. Should be under the rib cage if I could feel it. Any tenderness?
Nope.
Okay, you can breathe. And now I'm going to feel for your kidneys. Any tenderness, Anne, as I touch?
No.
Okay. That is a good sign. I'm just going to palpate each quadrant, and I do feel different objects, which is normal because we have different organs and things in our tummy, in our gut. That was light palpation, and I would also do it deeper palpation. Okay, and then we're kind of move our way down, looking at our legs, and no abnormal hair distribution, no swelling, edema, none of that. And I'll have you thank you, yes, bring your toes to your nose and your feet like gas pedals. Great. And can you bring this knee up? Okay, and now put it down and do the other. Good. And how about both? Great. And can you bring them, keep them together and then go to the side and then to me? Great. Okay, now just relax and let me do some of the moving. Any pain?
Nope.
Okay. Good. Alright. And can you push your legs against me or try to move them to me? Good. Move them towards you, or towards that way. Try to move them down. Good. And up. Okay. And then I would do it to the other leg as well, and I would also have you with this leg, or actually be your right one, go against. And any pain there?
Nope.
Nope. Okay. And at this point I would test her Babinski reflex, which I don't see her toes curling in. Check her pedal pulses, her posterior tibula, and popliteal. Alright, and I feel in there. And let's see if I can, actually I'll have you sit up now. And there's just a couple more reflexes and then I'll have you stand and we'll be done.
Okay.
I'm going to test your patellar. Good. Now just relax your foot. Your Achilles. Just saw your foot go up. Good. And I would also, at this point, test for sharp and dull feelings along your legs. So it's good that your legs are uncovered. So if you could tell me when you feel sharp or dull, okay?
Sharp. Sharp. Dull. Couldn't tell. Sharp. Dull. Sharp.
Good. And I do that on the other leg and then also as well on both of her arms. I'm just going to see, so here's one feeling, and then here's two.
Okay.
And close your eyes and tell me if I'm doing one or two.
Two. One.
Good. Okay. Did I do the hearing? Yeah.
The rubber and run.
Yeah. Okay. So now I'll have you stand up and then face the other way. And I'm just going to have you bend over. Good. And I'm looking for your flexibility and for any scoliosis. Your back looks a little higher on this side. Has anybody ever talked to you about scoliosis? Or
Yes,
mentioned that?
I have mild scoliosis.
Okay. Well, I do see that here. Okay. I'm just feeling your spine. Okay. You can stand up.
Oh,
Okay.
sorry.
No, that's okay. And then your scapula looks symmetrical. As do your hips, and you're not uneven. Okay. Turn around and face me. All right. And if you can, I'm just going to test some of your brain function. If you could close your eyes, put your arms out. Yep. And then touch your nose with one hand at a time. Good. And now slowly go faster and faster. Great. Thank you. All right. And can you stand on one foot? The other foot? Can you jump? Can you jump on the other foot? Good. And can you walk on your heels? Tiptoe on your toes? Okay. And then I'm just going to have you close your eyes and I'm going to give you a little nudge, and if you can, just try to keep your balance, okay? Good. Now I'll have you go as close to the cart as you can, and then walk towards me with one foot in front of the other. Okay? And then just walk to me normally. Great, and walk back. Nice turn. Now, for the difficult one, if I can have you bend down, squat, and walk towards me. Good. All right. That looks good. Just to end this, do you have any questions about your breast exam?
No.
How to do that? You're instructed to do that. When you do your breast exam, do you ever check any lymph nodes here?
No.
Okay.
Just here.
All right. In the
armpit
square,
area. Yeah.
you do from the mid down.
Yep.
Don't
Kind
miss
of a
any spots.
up and down pattern.
Mm-hmm. And you just want to feel here. It's called your epitrochlear node. And sometimes if there's any inflammation going on or something in your breast that's not there, or should be, this could get inflamed here as well.
Okay.
So we'll just feel that on both arms.
Okay.
Anything else, Anne?
I don't think so.
I think I am done. Thank you very much.
Thank you.